we have to come up with a way to find more leading indicators for mental health so that we can then start to tie the leading indicators of mental health problems with the finances. Because we all know that there is a problem and it's costing us, but we don't know what it's costing us and we don't know how to pay for it, how to invest in it. So we need to start measuring so that we can then actually compare it to financials.
Where we want to get to is kind of rewriting the script of really what does well-being look like. It's more about just safety. It's about physical well-being, psychological safety, just the general mental state of our project team members and how we prioritize that for our project metrics more than just financials. What we really focused on, and we did rework this a little bit, but our new message is how might we address the imbalance between financial, environmental, and individual wellness metrics for projects in ways that consider the direct and indirect impacts of neglecting people. It's all about people. So that project success benchmarks become a reflection of our needed priorities. So really what we're doing is there's this culture and this idea that projects are successful if they stay within the financial means. So we're really working on how do we remessage that? How do we start people thinking about a successful project is the well-being of your people?
So we all know that we're measuring cost on jobs. And part of balancing wellness metrics is we eventually have to measure the cost of poor mental health. So given that we know how to measure cost, profit, share price, physical safety, this is one reason we didn't dive into planet, which is one of the words we crossed off, because there actually is movements in sustainability. And part of that is because companies realize it affects their share price. So we're measuring that. What we have zero data for is mental health leading indicators. We have lagging indicators. We have lagging indicators like 26% of opioid deaths are coming from our industry. 20% of suicides are coming from our industry, but we don't know what's leading to it. So given this, when we can start coming up with ways to get leading indicators for mental health, and we're going to coin this, such as the construction assessment regarding emotional state, CARES rating. Yeah. We can now start to tie these leading indicators related to mental health to finances. We already have finances. With that connected, now insurance companies can start to pay attention to it because we're speaking dollars. The owners can understand it better in terms of dollars. Regulators and finance industry, and better yet, we're going to help the people who are building the jobs and their families. So with that said, we need everyone in this room, we need help coming up with what do we need to measure? What do we need to think about that can actually drive tying it to finances so we can get some movement, so that we can compare the cost of a job in regards to mental health. With that said, Jackson is going to go over how the analogies are like, this isn't so crazy and groundbreaking. Like, we already do this in a form.
And we've done it for years in the industry. So just researching, 1935, Miller Act introduced federal bonding, and now we have bonding surety every project, a lot of projects. 1970 introduced the Occupational Safety and Health Act. You know, we figured out there was a price for safety. We legislated it. We made it forward in the industry. 2006, we introduced LEED and energy efficiency design standards in the industry, started legislating that. So it looks like we're on a 30-year cycle. And so we're quickly approaching that 30-year cycle. And what's the biggest cost driver for our whole industry? What's the biggest cost driver for waste? Well, we think it's the cost of poor mental health. So on projects, you know, we go after cost, we go after profit, we go after share price, we go after physical safety. I think we looked at a stat earlier. Was it 2006 or was it 1996? The death of a worker in the physical, like if there was a job site related accident, it was $4 million. $4 million in the industry impact if an employee died. So we've now, back in 1970, we started legislating safety, started investing in safety, physical safety. We've now got what is the average death rate. Sorry to get dark. The death rate out of 100,000 workers in our industry is 3.1 today. So 3.1 out of 100,000. We've made a lot of progress in a little over 30, 40 years since we've introduced OSHA. So now here we are as an industry with 41, was it 41 or 51 now?
41 out of 100,000 people a year.
Just suicide, not even including opioid-related deaths, which all point back to mental health and the lack of our measuring or investing in mental health safety and mental health and wellness for our industry. So 4 million related to job site-related accidents per employee. Look at the cost. Owners are going to look at cost, profit, share price, and they're going to look at, we don't have costs to be able to invest in this, but the cost of not doing it is 10 times greater than just turning a blind eye and saying we don't have time. We can't do this. The money is in the ecosystem. It's in the economic engine. It exists. Our mindset is not there digging it out. So it's hidden, but it doesn't have to be. We all know it. We all see it. We've all lived it. And now, fortunately, we see a cyclical change that comes in our industry in about 30 to 40 year cycles. We're quickly approaching that. It starts with these conversations and the seeds we plant moving forward. So similar to how experience modification rating has existed to connect the risk of insurance, financial metrics, safety on site, something like the construction assessment regarding emotional state rating is what our industry has to deliver. It's what we have to go after, not just to take care of the families in our community and the people that we need to build our projects, but because there's actually really, really significant profitability and financial returns for the owners that are out there wondering why their busted budgets and buildings aren't getting built the way they used to. So actually, when we came up with construction assessment, I think the term actually should be craft worker assessment regarding emotional state, because the craft workers are the ones that are out there building this environment. Technology is not going to fix it. Design's not going to fix it. Money's not going to fix it. The people who show up to our job sites or who are currently not showing up to our job sites because they're not healthy, they're not well, they can't be there. If we don't have them, money ain't going to solve it. So that's our future state, and that's the ask of the industry is, we've done it before. We did it with the EMR. We did it with physical safety. This is what we need, and we can change the industry.